Welcome to Wellness by Designs. I'm your host, Andrew Whitfield Cook. Today we're joined by Alvina Foo, a pharmacist who has a keen interest in evidence-informed nutritional and lifestyle therapies to complement pharmaceutical management of disease for her customers, her patients. So thanks for joining us today and welcome, Alvina. How are you?
I'm very well, Andrew, and thanks for having me.
Our pleasure, our absolute pleasure. Now, you have a deep interest in nutritional therapies, but first of all, I just want to go back to where this might have started. Like, were you this way inclined in your childhood from your parents?
Well, during my early primary school years, I had, a bit of coughing, and which was really not formally diagnosed as asthma. But let me just go back a little bit, giving you a history of my parents. So they both survived World War II, and life was really hard. And mum basically lost her parents when she was 12, and no formal education, and dad, to make ends meet, he had to work in Christmas Island, and I only see him twice a year for my almost the entire primary school years. So mum basically run the household, and so whatever information that she gets, it's from family and friends and relatives. And so during that time, I was just coughing a lot. And mum will basically, the management was to give me herbs. We used to go to the Chinese herbalist down the road from us, getting lots of herbs, and I have very memorable experiences with herbs and the good old cod liver oil. So I grew on that and lots of, lovely bitter herbs. And also, friends of hers said that, friends of mine said that swimming is actually really good for your coughing. So from a very young age, I was swimming, weekly. Mum would take me to the swimming pool and swim. So that is sort of, the management. And then I remember there was a period of time where my coughing or asthma got pretty bad. And so I was sort of sent to my auntie. That's my mum's elder sister, one of the elder sister. And it's like a detox program, to be honest, for a child, because basically, she was a little bit more health conscious than my mum. And I would have no junk food, and that's just terrible for a primary school kid. And I remember drinking lots of vegetable, meat, bone broth, pretty plain food in, my opinion. But during that time, I actually got better. But of course, as a child, you really don't want to admit to that because you still want your treat. So, but that, I think that experience actually really, I don't know, I had a profound impact on me. And so that was sort of my little, childhood story. And on odd occasions, I remembered going to the doctor, and I don't recall having lots of antibiotics, but I remember, when we had some big, and also doctors in Singapore actually dispenses. So, so I never knew what a pharmacist role, I don't even know that they existed, but I remember seeing the antibiotics on the shelf and trying to, pronounce this drug and couldn't even pronounce it, and think, wow, wouldn't it really be cool that, that I could actually know what all these drugs are for, and and know how to pronounce them. So that was interesting, and I am a pharmacist.
So, well, there was a lot that happened in between there. So you emigrated to Australia.
Yeah.
I would imagine that would have been in your sort of late high school era. Is that right?
Yes. Yes. So I did my year 11 and year 12 in
Right.
in
And then it was like pharmacy all the way. Was it like, I know what I wanted to do? Why not medicine? What was the change? Was it because you're more interested in the drugs, what the drugs do?
Yeah, to be honest with you, Andrew, I when I was in Singapore, I went to it was a top 5 junior college in Singapore, and the amount of stress, it was really stressful. And because I played in inter-school, badminton, so I train a lot too, and so there was it was very demanding. Like on one hand, they actually expect me to do really well in sports, and on the other, in academic as well. In fact, I actually took
Mm.
triple science. So in Singapore, that sort of
Hey,
like paved the way into medicine. And
right.
but yeah, but with the pressure, I decided that, I don't know, I just thought that medicine, knowing about drugs was actually quite interesting for me. So I just took
Mm.
that path, and I really enjoy chemistry. So
And,
yeah.
and so what was it? I mean, you became a pharmacist, and pharmacists, orthodox pharmacists at least, are pretty suspicious of natural medicines. So what was it that led you to be open to natural medicines? Normally what happens is I did this. My father was interested in natural medicines, and as soon as I did
Yeah.
nursing, it was like, get away with your natural medicines. They they don't work, and
Yeah.
only
Okay.
drugs, they work and things. So what was it that reopened your mind to natural therapies, or did it never leave? Were you always open to natural therapies and their benefits?
I guess I was always open to nutraceutical, to nutrition. And when especially when I have my children, that really got my interest going again. So both my kids, when they were young, they have eczema, and I remember talking to integrative immunologist, and he actually said, well, try going off dairy. And I thought, oh really? So I thought, oh well, like I can just give it a try. And her eczema, it was sort of appearing on her face, and it was like she got little pimply bits. And so within a couple of weeks of staying off dairy, her face would clear, and I thought, wow, this is this is really interesting. And then along came my son 2 years later, and the same thing happened. But this time I thought, like all parents, you want to give your kids really good food choices. And I was actually making my own yogurt, right? So I took everything off, like, dairy, whatever, cheese and everything. And I thought, okay, well, no. So, but this can't, I made this yogurt, so it should be okay.
Mm.
But until I actually removed that yogurt from his diet, I noticed that, the eczema on the back of his knee cleared. And so I thought, wow, this is again, it's interesting. And then a couple of years when he was, I think 3, he had 3 or 4, I can't remember now, but he developed asthma, and he
Yeah.
also had some nut allergies. So when I went to the pediatrician, had a chat. But by then, like I have actually done the primary course of in with ACNM, which is the Australia College of Nutritional and Environmental Medicine. So I did the primary course. So I knew, a little bit about nutritional medicine and the environment, and, food, how it can actually impact on the health itself. So when I
Mm.
had a chat with a pediatrician, and I was just sort of just saying, oh, well, look, could food have anything to do with his condition? And I got a pretty straight answer. Go, no, food has got nothing to do with it. And
Not
so
even nuts? Like, what?
no, and so it really did make sense. I thought, okay, well, so I've got this child that have nut allergies. I mean, macadamia, some worse than others, that, with macadamia, that's almost, close to anaphylactic, actually, like you wheeze, throw up, and can't breathe, which is not a good thing.
No.
And then to turn around, and also, obviously my experience with dairy and my kids, and then to turn around, all these things, it's not just local, not just gut dysfunction and having all these different inflammation, and to say that food has got nothing to do with it. So I just thought that's really, really interesting. And I guess, that takes me to, back to uni too, when we learn about, certain interaction, drug nutrient interaction, it's almost like whatever you learn, I don't know about you, Andrew, but, whatever I learned in uni, you don't seem to question it, it's like dogma. Yeah. We've learned certain things like, okay, well, warfarin, remember, you've got to counsel the patient about, food that's rich in vitamin K. That could actually reduce the effect of warfarin, reduces the INR, and another typical one would be, grapefruit juice. So people on felodipine and certain calcium channel blockers and statin, you need to advise them, not too much grapefruit. And also the use of folic acid in methotrexate treatment, clearly it depletes the folic acid. And so, I'm just naming 3 things that I could recall, from uni, and think, well, what about all the rest? Obviously, these have profound effect on the body. It's amazing. I mean, there's a common saying, I think it's called absence of evidence is not, evidence that's actually absent. Did I get it right? Or was it the other way around?
Yeah.
So basically, So it's not like, you have to actually look to find it sometimes.
Well, that's a very interesting thing you say, because Yvonne Coleman, a dietitian, has actually, every few years, she decides to harangue a class of drugs, and she will contact the drug companies. They have this information. So plasma binding, things like that, they know this stuff with nutritional depletion. And it may not be present in a true clinical deficiency if you're on one drug that does that. But certainly when you have patients who are on 2, 3, 4 drugs, then you start to get into real issues of depletion, nutrient depletion. So it's really interesting, her work, and she has these cards where you write down the drug, then you write down the plasma binding and the nutritional deficiencies, and you see a picture emerging, and you go, holy crap, no wonder they've got, tingling hands and fingers. Yeah, it's really interesting what she sees, what she finds out.
It is interesting. And the fact that, sometimes these patients might be taking the drug for a very long time, like, 10, 20 years. And while they may not have the problem before, but at the same time, they're getting older. And, if they haven't been correcting their nutrient depletion, then it just keeps getting worse. And, for example, in, hypertension, for example, that's a good example, when they go, well, I have a really healthy diet. And I'm not knocking back a healthy diet. Like, nothing can replace a good foundational, well-balanced diet. But if you have so much repair to do, and I tell patients all the time, then, you need those extra nutrients. All of a sudden, that or the nutrient may not be sufficient. Say, for example, you come out of an operation, you need more to repair. So
yeah, absolutely. Convalescence is a big area, isn't it? So can I ask you, by the way, so did it cement in your mind your interest in nutrition and lifestyle interventions when the medical model failed you with your son's asthma? Was that when you just went, to hell with it? I mean, like, I've got to search for answers?
Yeah. Well, look, I always see a place in medicine. I mean, it's great. Like, I mean, I wouldn't give up the salbutamol when he has an asthma attack.
Ever, ever.
No, no, no,
No,
no.
don't
But
be doing that.
there is, and don't get me wrong. Western medicine is really good for acute conditions. Your antibiotics. Surgery and all that kind of stuff is really important. But when someone actually has a chronic disease, then you've just got to go upstream, and that's what my son with his condition actually taught me. And so that's when I went upstream and go, well, what's actually really happening here? And so I really, not giving up per se, with Western medicine, but to really integrate the and looking at the biochemistry and look at the physiology and
Mm.
looking at what is this drug trying to mimic in our system. So there
Yeah,
are no
absolutely.
fluticasone receptors, so to speak, but they are things like receptor for your magnesium, or transporters for magnesium, sorry, and different neurotransmitters. So exactly, so I tend to really question and get quite nerdy about it, to actually look at what is this drug trying to mimic in our body. And
Yes,
then
well
very
done.
often it really then gives me a bit of a clarity. And also, what I find really interesting too is actually look at the side effect. And sometimes I don't even need to look at the consumer medicine information to actually look at the side effect, because when the drug where it actually works, um, and or what other system it actually affect, then the side effect is actually quite obvious. If that makes sense. So, for
Yeah.
example, a beta blocker
Y-
affects sleep, then go, oh, it actually affects melatonin. Then you go, okay, no wonder.
Well,
So, and
see this. I've got that same interest in how drugs work, and I've got to give a shout out to Dr. Robert Buist, Bob Buist. Years ago, he was the editor of, I'm going to get this wrong, the
yeah,
Australasian Journal of Clinical Nutrition. Um,
okay.
And I remember reading excerpts and summaries of studies, and I thought, where do you find out about the side effects of the biguanide drugs, and the lactic acidosis that some people back then could get, and I was going, where do you find this stuff out? I was never taught this in nursing, and it
Yeah.
took a real mind
To
switch
think that way.
to
Yeah.
yeah, to think
Mm,
about the biochemistry. So, for instance, if
mm,
somebody's, for instance, got the side effect of a cough with a beta blocker, well, what does a beta blocker work on? The receptors and
Ace.
for instance, sorry, if I'm talking about
Yeah. Ace.
ACE2 inhibitors, and
Yes.
if you think about angiotensin and angiotensinogen and the 1 and 2, then it goes from the
Yeah.
kidneys to the liver. And then you go, oh my
Yeah.
God, these receptors are in the lung, and that's why you're
Yeah.
coughing. And
It
that's
is
when these side
fascinating.
effects to me make sense.
Yeah. You know what? To be honest with you, I used to hate biochemistry. I used to hate the Krebs cycle. I just studied, like, who I mean, on earth would like the TCA, the Krebs cycle, but yeah, I never really did understand why, study that. But now I actually refer to it back and back, to those biochemistry pathway, and find it just fascinating. Yeah.
Yeah, absolutely. And forgive me, I forgot to mention, I only mentioned her name, Yvonne Coleman. So it's her business is Nutrition Consultants Australia. So for anybody watching or listening, you can go
Okay.
to her website and you can get her folders. I mean, they're huge. The folder's huge. And it's
Wow.
just so interesting. Yeah. So
Mm.
I've got to ask, Alvina, how do you juggle the responsibilities and, I'm going to say, the restrictions of scope of
Mhm.
practice as a pharmacist? How do you juggle that with your love of integrative medicines and lifestyle interventions with your patients? Because I know your customers are demanding these answers, correct?
Yeah. Yeah. Look, I don't even see that as, I think it just comes natural to me because, like when I see the patient and, when I dispense a certain medication for them or they've started taking, say, for example, a diabetic medication and they're newly diagnosed, then it's about caring
Hmm.
for that patient and to give them an idea, like with, I know lifestyle intervention. It sounds so cliche and lip service. um, but say, for example, they would have come in for, a newly diagnosed diabetic, then I would obviously talk about their medication, how it works and what to expect of the medication. But I'll talk about the condition as a whole. And for example, alerting them to going, well, look, this is actually not so that you can actually get away with your poor diet. You have to actually book in, see a dietitian, and just to make sure that that they can actually further educate you on food, and to then alert them to, say, for example, the impact of high, blood glucose level. And we know that, with studies showing something ridiculous like 45%, like diabetic actually have a 45% increased risk in all-cause mortality. That is like, let it just sit for a while and just think 45%. It's like, wow, that's huge. And even someone with a HbA1c of more than 5.5, we're like, look, and you think, wow, there are a lot of non-diabetic with, more than 5.5, and the alarm bells haven't
Yep.
actually rung yet. Because maybe they haven't actually been to the doctor. But they're the category of people who are, non-diabetic, but there's still increased risk. So I'm really trying to, I guess, make sure that they don't have a serious cardiovascular event, and just to warn them, because sometimes, they might have gone to the doctor and goes, oh, doctor says, some people are more proactive than others. And so, the people who are not as proactive and not as in tune with everything else, and I'm just sort of like warning them and go, well, look, you really need to keep this under control, and you really, if you haven't, and I've got people who actually not bother to check their blood sugar level, or they'll say that,
What?
I'll check. I'm serious. Like, I have come across people who go, oh, look, I get that test done, like the HbA1c every 6 months. And
God.
yeah, I'm fine. I am not kidding you. And so
My
to
wife's complaining
actually,
that I'm a little bit ratty lately.
yeah, I, and,
Imagine that
and I have
conversation.
to, and especially, I find that, when they're newly diagnosed, that's where I want to really give them that education, and to say that, look, maybe in the beginning, perhaps it might be a good idea, and so that what the food, your favorite food, have, what kind of impact that it has on your blood sugar level. And so I'll tend to then educate them to, do it, before their food and 2 hours after, and, things that they may not think that it affects their sugar, because there are a lot of seasoning and, sauces, and that could actually carry a lot of sugar. Then I talk about, the sleep and, just addressing, and really having that time to actually really listen, and then just to address the other issues. And they might, for example, someone with high blood pressure may have a lot of stress. Funny that stress may have something to do with hypertension. And so
Funny
from that
that.
point of view, and or they have, some, like, but you have to really, I guess, listen and really want to know what's actually happening. And from there, you you find that patients will start to open up, or they go, well, look, I'm really
Hmm.
stressed about certain things, and then that really opened up the conversation, and I'll say, well, how do you sleep? And then I may then, when it's appropriate, I would recommend some, supplement. For example, I might say, well, do you know about magnesium? I mean, look, I yeah, that's one of the things I recommend a lot. Magnesium.
Yeah.
So
Yeah.
magnesium also serves like a private chaperone for your melatonin, which helps with sleep.
So,
So those are some of the things that
so
like that I do.
no.
Sorry, Andrew.
Forgive me. So, I was just going to say, from what you've told me, I would actually
Mm,
say it's not just within your scope of practice. I would actually posit that is your responsibility to cover other factors that might play a part in long-term management with medications.
yeah.
For instance, we know that, I mean, you've just mentioned 30% increase in all-cause mortality with diabetics. There's an increased risk of kidney
25.
injury when people are
Yeah.
on ARBs and they are added a fluid tablet like a
Mm.
hydrochlorothiazide.
Hypochlorothiazide.
Yeah, and then it's also your responsibility to, if they're on, forgive me, sorry, an ARB, a CCB, plus a fluid tablet.
NSAID.
Now you have to make sure that they avoid NSAIDs because of the triple
Yeah.
whammy, which is a
Yeah.
known massive increase, 34%
Yeah.
odd increase in kidney damage. So what to do if the patient in front of you has a sore knee? So I would
Mm,
say it's actually within your scope of practice and your responsibility to say, okay, well, you can't take NSAIDs. So you're either stuck with paracetamol, or we investigate things like curcumin, glucosamine, fish oils, krill
yeah.
oil, whatever. So collagen.
Yeah.
So I would actually
Yeah.
think it is your responsibility to do that.
Yeah.
You're looking after the patient's
Yeah.
health.
Yeah. So Andrew, I do see that often, and sometimes I do see even prescribers. They would prescribe, believe it or not, your NSAIDs when the patients are actually on this medication, and they do say, look, because the only thing that they have in the toolbox is NSAID and paracetamol. I mean, what else can you offer? So now I'm trying to expand my toolkit, and so when those patients come in and they're taking the NSAID, like firstly, I'll never undermine what the doctor says, and because our doctor says I can use it for about maximum 3 days, and I go, okay, well, look, that's fair enough, and then I'll warn them about the repercussion that may happen,
Mhm.
and then to offer them, I go, well, do you know that on long term, these are some of the things that you can actually take. And so that's where I talk about the curcumin and collagen peptide. That's one of my favorite
Mhm.
favorite things I actually recommend a lot of for various different reason. Um,
For when you say
so
for various reasons, so not just for pain relief and joint sort of
no.
support, but what else?
Okay, so with collagen peptide, I use it a lot for sports injuries. So, for example, if someone were to come in and funny that because sometimes they'll come in with a script for NSAID, um, or they come in for or just wanting to buy something over the counter, a knee brace or something, and that's when I start the conversation. And I always like having a conversation with people and find out like what's happening. I want to know. Let me know what's going on so I can help. And they go, oh, look, I've just had a twist of my, like I did something silly, da 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 da. Ankle's now really swollen, or a tendonitis, or whatever. And I go, well, look, okay,
Mm.
well, look, take the NSAID, just to help with the pain, acute pain, but to help you recover. Like I have, really, really good reports. In fact, I had this person that came into the pharmacy, and they were actually in the military, and they really
Mm.
had no time to be injured. And
No.
so I recommended some curcumin for the person, and also collagen peptide. So collagen peptide is actually really important for connective tissue. I mean, it does so much more, but so just for a repair point of view, it's really important for the tendon, cartilage, for your bones. But just a word about collagen peptide. I mean, they're not all the same. So the one that I get quite excited about is actually um, the manufacturer is actually Gelita, and I knew of Gelita probably about 7 or 8 years ago. And honestly, it was through a conference that I went to, and I was talking to an integrated doctor, and he says, "Oh, Gelita has got really good collagen peptide," and I was like trying to search for it, and I had to jump through hoops to actually, get the stuff. It was from, the company was from Germany, and so I kind of really gave up on the search because it was just so hard.
Yeah.
And then, there's a particular company that brought in the Gelita collagen peptide, and I just got so excited. And so that's the stuff that I use, because there's so many different collagen peptide, and they actually go according to the molecular weight distribution profile. So they all do different things. So this particular
Yeah.
one, you have, like, for example, the collagen peptide that could actually help more with the cartilage, and one for the bone, and certain ones for for the skin. So yeah, so that application. And the other way I use collagen peptide is just help repair. For example, someone have actually come out of a post-op, or having gut issue, and they're not able to get their nutrient. Maybe they've got some gut dysbiosis, just maybe. Not many people do. Sorry, Andrew, I've just been sarcastic there. um, um, and so that's how I use it as a food, as almost like a protein supplement, because
It's kind of like going back to your bone broth.
Yeah, well, it is actually a broken down of protein. So you've got all the building blocks that's ready to be used. So
have you found that the use of collagen is displacing the historical use of glucosamine? Have you found that your collagen sales have gone up and your glucosamine sales gone down, or do they work side by side?
No, they do work side by side. I mean, glucosamine, that's a different. I mean, it's a GAG, glycosaminoglycan, and collagen peptide is, I think, regarded as a proteoglycan, if I'm not wrong there.
Right. So
they
slightly
they
different.
really, they work different. Glucosamine sulfate, I use it a lot too, for not just for the joint, but for the sulfur component, for the sulfation. It's actually it's wonderful for the gut, but So, and it's also really
Very
good
true.
for other things. Yeah, very, very interesting.
And so, what other nutrients or lifestyle interventions do you commonly use in your pharmacy? I guess where I'm thinking here is, name me a GP who will talk about. I mentioned before when they're on an ARB or a CCB, and they add a fluid tablet, and they have an increased risk of kidney disease. Name me a GP that will talk about fluid intake, to increase your fluid intake because of the siphoning action of the kidneys. Do you go into this because of attendant risks of medications? Is this what you do just as normal day to day?
Yeah, so with the GPs don't tend to. I don't know. In my opinion, anyway, unless they have heart failure, then there's a conversation about fluid intake. But most of the time, they really don't talk about it. And actually, what I find, Andrew, is that when they're actually on a diuretic, it's standard. They tend to actually order tests looking at the biochemistry of potassium and sodium. But what really get missed is actually, I'll say, magnesium. So I talk a lot about magnesium, because the gold standard for magnesium tests is, and sometimes you think it's ridiculous. We look at the plasma magnesium, which constitute less than 1% of magnesium, and we know that 50% of magnesium sits in the bone. 25% in the muscle. So it's really, and then I actually had this conversation with the patients to say that, well, in terms of bone health and also with heart health, especially when they're taking all these cardiovascular medication, right? And I was like, well, magnesium could be actually really depleted. And there's no real good tests. And sometimes, they could present with clinical symptom of cramping. I mean, that's one. But sometimes, unfortunately, you see them taking a CCB, a calcium channel blocker, down the track, and you think, well, guess what? Magnesium is also a natural calcium channel blocker. So that's something that I try to address, and that's where I like using and because some patients are quite complicated, and I sometimes like to use just a pure magnesium. Generally, sometimes a powder is much. I like the flexibility of using a powder where you can actually dose a bit lesser or a bit more. And that's something that I use quite often. It's magnesium, and people actually notice a difference and they go, "Oh, I sleep better."
Yeah.
And as I said before,
well, sleep and also hypertension is one of the quickest actions I've found with magnesium, essential hypertension. And quite incredible.
And the thing is, like I say it all the time, like magnesium, depending on who you talk to, I mean, some data would say that, magnesium is involved in 300 enzymatic pathway in the body. And I remember going to a different conference, a scientist was saying, well, actually, in fact, it's 600 different pathway. And so it's, well between 300 and 600 different pathway. And so, when you're dealing with stress, the HPA axis and everything else, and and magnesium is also really important for your mitochondria function, which actually leads me to another one of my favorite is ubiquinol, because it is actually required. I think the co-transport, the step, I think it was the step 2 and 3 of the mitochondria, in terms of making ATP, is really important. So someone with heart condition, and remember, one of the examples is someone with actually mitral valve replacement, using ubiquinol, and she found a profound difference in terms of her energy level. So, and I think, that is well documented, and some cardiologists wouldn't actually dispute that. They may roll their eyes with some of the different supplements, but ubiquinol is something that that they, I think, quite aware of. So ubiquinol is one. Magnesium. Sorry.
This is this sort of goes off the back of Professor Frank Rosenfeld at the Alfred Hospital in Melbourne, and he used with valve replacements and cabbages, coronary artery bypass grafts. He used magnesium orotate, CoQ10, lipoic acid, and selenium, and fish oil.
Okay.
Yeah, and fish oils. Yeah. So it was really interesting. The thing I love about magnesium orotate is that it basically works. It helps the muscle cells, particularly the myocytes, to work under deoxygenated conditions. So for instance, a failing heart or a stressed heart, really interesting stuff. And I think Professor Frank Rosenfeld isn't given enough honor because of his work for helping transplant patients to receive a heart, not just 4 hours post, what do you call it? Not exhuming it, but anyway, take it out of the body. So previously a heart would only last around about 4 hours out of a body. He extended that to 12 hours. So what does that mean? It means that somebody can fly a heart from Sydney to Perth and you can still get a recipient. And that's amazing. Dramatic.
Wow. So, 3 times the time.
Yeah. So with regards to CoQ10, he was also involved in the Q-Symbio study, and again looking at heart failure. But it's really interesting work that just isn't listened to enough by these cardiologists that you're talking about. I'm glad that some of them are waking up.
Yeah, but ubiquinol is actually used in the sports and nutrition as well. I mean, that's been, quite known for a while. I think, back in those, I think Leighton Hewitt was known to be taking, CoQ10. And they, these people actually take a really high dose.
Did that make his hand go like this? Hey, Alvina, we're running out of time, so I just want to cover off on one more thing, and that is that I understand you've written a book. Tell us quickly about why you wrote that book. What happened?
Yeah, so when my son was in primary school, he volunteered me to do a talk. He said, "Mommy, like the teacher wants someone, to talk about healthy eating. So I thought you could do it." And so I thought, okay. So I have thinking 25 kids, in primary school. How am I going to capture the attention? I can't be talking for 20 minutes. I would just lose them. So I started drawing, little pictures. And so I presented the whole story, about the gut, about different food. And so when I was actually presenting, so I was like holding up these little pictures and comics and all that. And I was actually pretty proud of myself. I thought, oh, well done, Alvina, well done. And so when I presented to them, we went for about 20 minutes or so, and the kids were so engaged and they had so many questions, because of course, I was asking them questions halfway through and trying to engage them. And so that really inspired me to writing a book, while, drawing and illustrating. And so that's what I did, about the microbiome and, having a bit of a joke, so it's not as serious, you learn best when you're having fun and, laughing, right? So that's what, the book was like. And during that time, my kids were really into the treehouse story. I can't remember the names. There's so many treehouse. Andrew Denton. No, not Andrew Denton. But anyway, I can't remember the author now. So that it's that kind of humor that I just wrote it.
And did the kids? How did the kids gel with it? How did the kids gel with that book?
Yeah, no, it's good. Like I had some parents that told me that, and even parents were entertained because some kids are too young to actually read it. So the parents will be reading to them, and they had a laugh too. There's some things like multiple choice question. What consists. What our body made of, is it cells or bananas or, jelly beans? And so they have to pick the right answer. It's like, oh, don't be silly. It's not jelly bean, So, yeah, so it's like a fun illustrated book.
Yeah, I think a book that has poo in it is always going to get a giggle out of kids.
Yes. Yes, very true. When you talk about poo, you get the laugh. Yes.
Alvina, your dedication to nutrition and helping patients to either achieve or regain their health after injury, or also, medication mishaps, things like that. I mean, it takes true dedication to lead a patient through that. And I really applaud you for it really is a dedication as a pharmacist, as a caregiver in the community. And I really do applaud you for that. And thanks for taking us through a little bit of what you do in your local community as a pharmacist today on Wellness by Design. It's been great.
Yeah, thank you very much, Andrew.
And remember, everybody, that you can see all the show notes and the other podcasts on designsforhealth.com.au, or of course your best podcast app, your favourite one. So thanks very much for joining us today on Wellness by Designs. I'm Andrew Whitfield Cook.